And we're recording.
Good morning. Welcome to Mount Nittany Health Foundation's first in a series of plan giving topics, starting with estate planning strategies. My name is Melissa Unks. I'm the Senior Development Officer for Mount Nittany Health Foundation, and I would like to thank you for joining us today. There will be a time for questions after the presentations. Should you want to ask the questions, please utilize the chat feature located at the bottom of your screen, and we will ask the question to the panelists in the order that they come in. Our panelists today are Kathleen Ryan, President and CEO of Mount Nittany Health. Kathleen has served as President and CEO of Mount Nittany Health since 2017 and brings more than 25 years of healthcare leadership. She possesses a robust portfolio of experience that includes health system operations, physician alignment and growth, and corporate services. An alumna of Pennsylvania State University, Kathleen earned her Bachelor of Science in Health Planning and Administration. She earned her Master's of Business Administration from Ross School of Business, University of Michigan. Mount Nittany Health is a comprehensive healthcare system headquartered with 17 clinical locations that serve 6 counties, comprised of Mount Nittany Medical Center, Mount Nittany Physician Group, the Mount Nittany Health Foundation, and Mount Nittany Health Children's Advocacy Center. The system is the region's largest provider of primary and specialty care and offers more than 30 medical specialties, including cardiology, orthopedics, oncology, urology, and neurology. Under Kathleen's leadership, Mount Nittany Medical Center was named the world's best hospital by Newsweek 2021 and 2022, and best places for maternity in 2021. The medical center earned the Joint Commission's Gold Seal of Approval for quality care and patient safety and earned a 5-star rating from the Centers of Medicare and Medicaid Services. Joining Kathleen today is Tom Terracani, principal of Boyer & Ritter, having over 34 years experience providing audit, accounting, tax, and consulting services for a variety of clients and industry groups. Tom is a key member of several practice groups in the firm, but focuses primarily on tax services, dealership services, and forensic, valuation, and litigation services groups. Tom began his public accounting career with Ernst & Young in Charlotte, North Carolina, where he served as a senior consultant in the tax department until becoming the partner in charge of Boyer Ritter State College office in 1990. Tom is currently a member of Boyer & Ritter's executive committee and leads the advisory services group for the firm. Tom also serves on Mount Nittany Health's board of directors, Mount Nittany Health Foundation board of directors, and along with his longtime service to the organization's finance committee. Tom, thank you for being here today. At this time, I will turn the floor over to you.
Thank you, Melissa. And thank you, everybody, for participating. Get this working. Trying to get our screen moved. It won't move. There we go. There's our panel. Thank you, Melissa. Sorry for the delay. Objectives today. I get asked a lot of questions. Why am I so busy? And one of the reasons I've been so busy recently is wealth and succession planning. And so we really thought this would be a good little portfolio or presentation today on behalf of the hospital. So I'm going to really kind of focus on some of the things I've been working on and what's got me so busy. And when we start working with high net worth families, one of the first things I always try and do is really stay succinct with their goals. We're always trying to find out what their goals, what their desired goals are. And then second off, then we start working on minimizing taxes, things like that. But the real challenge that we've been dealing with is we have baby boomers are facing historical wealth transfer. And one of the things that I often run into with these baby boomers who have accumulated wealth is they're very reluctant to give up control and or assets. And also they're reluctant to talk about their legacy. So one of the first things to get their attention, I always ask is, what do you want your heirs that you're never going to meet to know about you? Because that helps drive legacy, and it helps us understand as advisors what they're looking at. So planning spends a lot of time really trying to understand the dynamics of the family. We're always trying to align the income and expectations, because what happens during lifetimes is the high net worth families that we work with, whether it's businesses or just accumulation of assets, they start giving out support and things to heirs. And sometimes there's unrealistic expectations that aren't aligned with what the documents say. The second thing we focus on is asset protection. That can be things like, we want to protect the assets from creditors or something catastrophic happening, or children are going to get married, and unfortunately in today's society there's a 50% chance that it won't end desirable. And that's one of the things I also do, is demarital mergers, as we like to call them. We also then, down the road, after we get those other things aligned, we then talked about structure, tax efficiency, asset security. And at the end, I would say one of the biggest things that I've worked on in the last year is, how do we help facilitate family harmony and ongoing positive interaction with the family? So today I'm going to use the word desired legacy a lot. I'm going to define that a little bit, but we like to use that term because it ingratiates everything I just mentioned, that it's trying to understand what each family's goals are, and then how we design the plan to work with that. And one of the biggest things that we're running into is, especially baby boomers desperately want their family to interact and work together going forward. And as we're going to talk today, philanthropy is a thread that we've been using to sow that interaction, and also bringing in the responsibilities of wealth. So stepping back a little bit, I alluded to a fact about baby boomers, and some of these statistics I'm going to throw up are pretty amazing. I've been working in this area for 10 years or so now. And the biggest area I work with it on is closely held businesses who want to monetize their life's work, sell, and or then set up plans for the future. So we always start with 50% of the privately held businesses in the US are owned by baby boomers. And I'm on the very bottom of that. It's actually age 58 now. So more than 80% of their wealth is tied up in their business and or their real estate. So it's staggering amounts of wealth. And the other thing that I think that's really become evident is our communities are observing many transition of businesses which used to be owned by an individual or a family, and is now being transitioned outside. There was an excellent article almost a year ago in a Wall Street Journal. It said Americans age 70 and above had net worth of nearly $35 trillion. And you know, those don't really mean anything to me, at least. But what really drives that home is, it's 27% of all the wealth in America, and that's up from 20% 3 decades ago. So those 70 and older have more than a quarter of the wealth in the US. And it's estimated that over 70 trillion. So again, it's more than just those 70 and older. That 70 trillion, meaning those probably 50 and 52 years old, are going to transition $70 trillion of worth over the next 20 years. So that's 61 trillion is going to go to heirs. So $61 trillion, which is a very large portion of our gross domestic product, is going to go out to millennials and X-Geners. And with the balance going to philanthropy, which is one of the reasons why we wanted to do this presentation, is to communicate ways that we're weaving that thread through here. The biggest thing we're trying to drive across right now is the baby boomers, those post-World War II, are really getting into the senior years, the back 9 of their lives, and they're really starting to face some real decisions on what to do with their wealth. The Wall Street Journal article also had this tremendous presentation, which really drives this home vividly. You can see what's expected to be transferred this year in trillions of dollars, and over the next 3 years. But if you start going out, 15 to 20 years, you can see it's staggering amount of wealth that's going to be transferred. And that purple section is charity. So it's anticipated that a significant amount of the wealth that's getting transferred, more so than it is now, is going to end up going to be using some type of philanthropy vehicle. So philanthropy vehicles are done in two different ways. I like to refer to them as deferred gifts, i.e. they're usually bequests at death, something that's going to happen in the future. It could be a triggering event like a business being sold or something happening, but it's a deferred gift. It's a commitment that somebody's making now to philanthropy. And another way that it's done is well, we're trying to make donors aware of this. So when we work with clients in this space, we're trying to expose them to all the different ways they can do this, because it's not just writing a check like the old days. There's a lot of different ways to do this, and it can get very, very involved. I'm going to use a term occasionally, the gray tsunami, and that's really the confluence of all of these baby boomers, in some cases inheriting assets from their family members in their 80s and even 90s, and more importantly, them transitioning out of their businesses, monetizing their life's work, as we like to refer to it, and evaluating their role with their heirs. And all of a sudden, for the first time, in dealing with a lot of high net worth families, they're sitting down and really trying to understand what it is their goals are. As you're going to see, I'm going to allude to this many times, baby boomers generally, I like to say, have their heads down and are focused on accumulation. They've not been focused on dissemination. The other thing about the gray tsunami is COVID-19. We all know what's happened the last 2.5 years, but what it really did, it effectively stopped all the planning that we were doing. I literally can go through a number of clients where we started doing some planning and then COVID hit and it just literally stopped. However, there's a sunset of the federal exclusion in 2026. So at the end of 2025, we've got a window of opportunity until the end of 2025 to do some more elaborate planning with our high net worth families. Now, I'm going to put this chart up. It's a chart I didn't create, so I don't hope it doesn't upset anybody, but it really drives home the fact that there's different cultural values by generation. And we're going to go through some of this, but I'm going to point out the ones that are most important to me, and I'm going to do it while it's up. The core value is something that is really drives home, and also the work ethic. And I know we deal with this at our firm with our practice. The baby boomers on a work ethic, a 60-hour work week, if you ask them how much they work, they never knew. They generally don't really worry about hours. They just work. That's what they did. Whereas the X Gen has kind of come in and said, well, I want to work smarter. I don't want to work harder. And the millennials, unfortunately, as I deal with and a lot of us deal with, that chart is kind of evident. But boomers have a different life. They have had different life experiences. And that's really important when we're talking with clients about what their goals are, is to make them aware their life experiences and their outlook is different. And views on money is another example. So the boomers have always had I'm willing to invest in myself, and I know I'll work hard and it'll work out. And I call that the leverage and strategy phase of saying, I'm willing to leverage my talents and my abilities, and I have a strategy to get where I want to go. The X Gen generally is trying to maintain what they have. So a lot of the things that we see, the X Gen that are getting money, they're trying to just maintain it and in some cases budget, but they're trying to maintain what they have. They're not focused on adding and growing generally. Millennials, again, millennials are going to be in their low 20s or mid to low 20s and below. And unfortunately, and maybe it's not any different than when I was 22 or 23, but their focus right now is they earn to spend, is the chart said. So they want to enjoy the day. and maybe they'll change and evolve. And that's what some people I've done this with have said, well, you were probably the same way when you were 24. And I'm like, well, I wasn't, but a lot of my friends were. So that's okay. So these are generalizations, but it's important that we have these discussions because the boomers have to realize the heirs are different. And I already alluded to success. Success defined boomers, the core value for a boomer is success. If you ask them, somebody who's built a business and built an empire, what's your core value? They would say success, whether it's adding employment, adding value to society, whatever it is, they view themselves as success. X-Geners, their core value is time. They want a good life and they need time to enjoy it. Remember, getting back to they're trying to maintain their wealth. Millennials, on the other hand, as again generalizing, they're individually. They're a lot of cases they're trying to find a purpose, especially where they've been given assets. So boomers have built their values, have built off of what they were given. In many cases, boomers are going to leave more wealth than they inherited. And again, I really emphasize that the boomers are in many cases going to leave significantly more wealth than they inherited. But they generally want their heirs to enjoy the fruits of the wealth. But they struggle with some of their priorities that they have in their lives, and maybe in some cases even their role in society, the larger society. So many heirs are the millennials and X-Gener, they're facing a reality that they may be challenged to leave more wealth to their heirs than they inherited, and are often less sensitive to their role in the larger community. Again, baby boomers have built up their businesses and they've worked hard, and the commitment back to their community has kind of foreshadowed the World War II thing. Imagine sending the X-Geners today up the mountain in World War II. I know I couldn't have done it, and I can't imagine what they did, and maybe they'd figure it out. But there's often a disconnect between the boomers' values and skills and their heirs. And we really do want to work through that. And that's when I get into this desired legacy. We're trying to work through what the senior generation's trying to do. Unfortunately, studies will show that only a third of the heirs that will successfully transition their wealth with their family desires. Businesses, only a third of businesses succeed the second generation, and only half of that succeed a third generation. And I'm often asked the question, why is that so low? And it goes back to the cultural beliefs. The boomers have different skill sets and different discipline, and in many cases, a different value system. And they learned how to manage success, and they learned how to manage wealth. When we talk about desired legacy, as I alluded to earlier, heirs often, parents want their kids to live their own lives. Very few parents I deal with say, I want them to take over the family business. I really don't see it that often. They want them to be healthy, successful, and maybe most importantly, happy. They really do want them to enjoy the benefits of their wealth, but they don't want it to go overboard. And they get concerned about, do they really know how to manage the wealth? Do they understand the importance of a family? And do they appreciate their role in the larger society? So those are oftentimes why the boomers are reluctant to sit down and really address their mortality. And they put it off. And because I like to say they're focused on accumulation, and they've been successful in many cases, and they have their head down working, and they just really don't want to be bothered by a consultant or an advisor telling them, you got to sit down and address this. And the other thing that kind of is interfering with our progress in this is they're concerned about their values, as I've alluded to many times. Their values are different, and they struggle trying to figure out how to communicate that in their planning. And then at the end, they usually say, if they stiff arm and they say, I'm not doing anything, they say, hey, They're just gonna have to figure it out just like I did. But as advisors, we really try and get them to move beyond that. So the other thing that's happened is today's society is very mobile. If you go back 30, 40 years, families didn't really move that far away and take opportunities. Well, that's completely the opposite now. Families are very geographically separate and they easily grow apart, even with social media. And parents honestly do want their heirs to get along. One of the things we always say is, one of the things when we get done doing our planning, we want and somebody passes away, we want the family to still be able to sit down and have Thanksgiving dinner. And I know that sounds odd, but it actually simplifies what our goals are for the family, that we want them to get along with this plan that we're putting in motion. So to get things moving, are the heirs capable of managing wealth? Will they interact? How will that work? Because sometimes there's dynamics that will not allow it to work, and we have to kind of design that in some of our planning. Are the family members financially dependent on this inheritance? And we see that, unfortunately, a lot, that this what they're going to inherit is something they're counting on, not something that's discretionary and supplemental. And then, of course, do the wills and trust documents reflect the planning that they desire? So then you say, well, how does philanthropy come into all this? Well, one of the ways we've used philanthropy in trying to achieve our objectives is making the awareness of the wealth. It's the first time we somewhat disclose to the heirs that your parents have accumulated a lot. They assume that, but sometimes they didn't know that. And so we've actually had meetings where we as advisors are involved in walking into, I call it the shallow end of the pool, to not throw them in the deep end and see if they can swim. And we're talking about the responsibilities of wealth management. How do you use advisors? And what's sustainable? What income is sustainable? And then the other thing is, how important is that bond to link the families into generations? I'm going to use an example that I think it's now 15 years ago or so. Kathy was an elderly client in her 80s that came in one day. She was actually a client of my father's who passed away. And Kathy had come into me, and she walked in and she was shaking. And she said, I just got a letter, and I just found out I'm going to inherit $8 million. I'm going to get $8 million in 2 months because my dad's company was sold. And she had gotten dividends off this company for 40 years. She never worked. She cashed checks. She never worried about anything. And she had done no planning or anything because the money came in every month, and she invested some and she spent some, and she really was never worried about it. So I started talking with her, and she had 2 children in their 50s, and they lived in different states, and they had grandchildren. They were all over. Most of them were in their late teens, early 20s. So what we did is we formed a partnership. She gifted the stock from the family business into the partnership. It was then monetized. And so we did a gift tax return and did all that stuff. We leverage gifts is what I do. I won't get into that now. And then she put a trust company in charge for 10 years. Now, what this forced the 2 children to do was they had to work with advisors. They had to understand investment allocation. And they also had to work with the advisors to understand what the payout was going to be and what was sustainable. So this encouraged a 5% payout. That's actually a payout of the assets each year to the partnership was paid out. And then she wanted the heirs to then decide how much of that payout to go to the philanthropy. So we set a goal, and the one child, one of the 2 children, then formed another entity to then do that. And so I actually oversaw a meeting with all the grandchildren, and I said, I want you to all develop a mission statement for philanthropy. Now, that was an odd thing to do with those 18 to 25 years old. They looked at me like I was freaking crazy. They had no income, and they're wondering why I'm asking them to do a mission statement. I said, if I told you that your great grandfather set money aside, remember the question I asked at the beginning, what is the legacy you want your heirs you're never going to meet to know about you? I said, if he wanted you to give money away, tell us what some of your thoughts are and what you want to do with that. So that started a process. Fortunately, they started looking at me as overhead and they said, we don't need you here anymore to pay you here. And that's good because that's what we were trying to achieve. So the grandkids now meet annually. They physically meet annually. Even though they live apart, they come in once a year, they sit down and they give some money, 5% of the quote money that's been set aside each year from the portfolio. They give some of it away to philanthropy, and they work with each other on what it is they want to do. So this legacy was started by the great grandfather. And as I told you earlier, a third of the families don't successfully transfer their wealth. Well, the 8 million that was transferred has doubled. So this process that we started 15 years ago, even though it's paying out 5% a year to the family as to support income, it's actually doubled. So their payouts have grown significantly also through the years. So again, it's been managed, it's been cultivated, it's been working with advisors, and it's achieving the goals that the great grandfather kind of verbally told the daughter, the grandmother, and who then communicated to me. So that was just an example. So she was very concerned about how the kids would manage wealth, and she was honestly more concerned they would grow apart. So we use this philanthropy as an opportunity to bring the legacy of the community and to provide a vehicle for responsible management and family collaboration. So we, as I said, we use philanthropy as a tool for wealth management to the family, and we use these meetings to discuss gifting. Parents really like that idea. Boomers especially like the idea that there's going to be a meeting and there's going to be decisions made on to talk about what their legacy is and what they want done. So it effectuates an extension of their commitment to their communities that they've made for many years that help them accumulate their wealth. And it gives also the parents or the boomers the ability to say, hey, when somebody reaches out and says, can you give us, we're soliciting for gifts. Hey, we meet once a year and we decide how we're going to give out the family's money. And it really does help the parents consolidate. And I'll be honest with you, especially as they get older and they get overwhelmed with people getting to them, it provides a facility for some control over the process. So that actually works out well. So as I alluded earlier, there's 3 ways we really work with philanthropy: gifts done during lifetime, where they can get a current tax benefit. So if I've got a client that says, I'm going to be giving everything away, I say, why not do it during your lifetime? Let's get some tax benefit. Deferred gifts, as we said previously, are gifts that are usually occur at some point in the future, some triggering event, most often a will, an execution of a will. They may say, hey, I don't know what I'm going to have, but when I pass away, if whatever I have, I want this % of it to go to this charity. And then the other thing we do is a kind of a hodgepodge of the two, is we set up a trust or an entity to do some of it during the lifetime, but it's going to extend well beyond the lifetime, like Kathy did with setting up that partnership. I'd be remiss if I didn't focus on IRA transfers. With the high net worth families that I work with, the easiest thing to do is to talk to them that once you hit 72, you're able to transfer up to $100,000 a year directly from your IRA to a charity, and it counts towards your required minimum distribution. This avoids being taxed. For high net worth families, the IRA, this is an easy mechanism. Any high net worth family individual that's taking money out and paying tax on it and then turning around doing gifting is not being efficient, and there's opportunities here to do that. We also have many families that like to gift appreciated securities. We do a little more sophisticated tax planning. It's a great way to diversify the portfolio, and it also sometimes helps us shelter other sale of other assets where the gains are getting triggered. And then we get into more sophisticated vehicles like charitable remainder trusts, things like that, where you can give assets to a charity and take back an income stream. And we've worked that very successfully with some families that have appreciated securities that don't have any dividend. They'd like to get a dividend yield off it. So we've used that very successfully a few times. So deferred gifts generally occur at death or some other triggering event. IRAs and deferred annuities are the most heavily taxed even after death, and are the ones that we focus on the first to use with philanthropy. So when I deal with a high net worth family, very rarely are we transferring the whole IRA down to the heirs. Oftentimes that's the first stop we make to do something for philanthropy or charity. Deferred gifts are used when it's known how much will be needed. As I said earlier, if you don't know what you're going to need, or if you don't know if you're going to have enough, deferred gifts are the most common way that we have real wealth getting transferred to charities, meaning you put a provision in your will or a trust. Just some other areas on deferred giving. We have charitable or gift agreements. It could be, I'm going to give, as I said, the charitable remainder trust. You'd have actually an agreement that you're going to give your money, say, to the hospital. You're going to give some assets to the hospital. The hospital is then going to commit to paying you back a return on that or payout on that based on the terms of the agreement. Donor advised funds have become very, very prominent and used frequently. Family entities I've alluded to, like we did with Kathy. And the biggest thing we're trying to do, no matter which stop we make here on these, we're trying to involve the family members in the decision process because we want them to understand some of that appreciation. So it's really important when you start talking about philanthropy that you select organizations that are going to be there and have the stability and the infrastructure to work with you. Unfortunately, in the Center County area, we've got some really bad examples on how that can go sideways where there's not a long-term organization. There's been a number of organizations and or churches that one day appear to be very prosperous and ongoing, but down the road aren't. So it's really critically important that you spend time understanding long-term impact that you can have. And there's nothing worse than watching a donor give gifts away and they're not and they aren't utilized the way they desire. And honestly, most charitable organizations, they are not built for sustainability. They usually budget year to year, and the decision makers today will probably not be the decision makers in 5 or 10 years. And a church is a great example. Churches have very dynamic leaders, and people are very quick to entrust that dynamic leader to use their judgment. But unfortunately, I'm Catholic. In the Catholic Church, they're going to rotate the priest at least every 10 years, if not sooner. And it completely changes the dynamics, and what you wanted, if it's not documented properly, is not going to be done. So with that, I'm going to introduce Kathleen Ryan, who I work with at Mount Nittany. And Mount Nittany is an example of an organization that does have the stability of time on its side. And with that, I'll turn the presentation over to Kathleen.
Well, thank you, Tom, and good morning, everybody. Thanks so much for joining us. And Tom, thanks so much for all the things you shared. Really helpful insight for all of us to be thinking about. I appreciate the opportunity to talk a little bit about Mount Nittany Health and to encourage you to consider Mount Nittany Health as you think about your philanthropy and as you think about how you might make an impact on our community. At Mount Nittany Health, our mission is healthier people, stronger community. And it's really that simple. Mount Nittany Health has been here in the community, in our local community, for 120 years with a legacy of, we get up in the morning and think about how do we make people healthier and how does that make our community stronger? We're a modern, comprehensive healthcare system. We have 17 locations across the region. We have 220 providers and 33 specialties. We're one of the largest employers in our region with 2,400 employees. We're locally governed. I think it's important that everybody understand that what's different about Mount Nittany Health is we are governed by a group of community members, people that live right here in our community and who use the healthcare services, including Tom and others like him who guide the long-term strategy and direction of our system. The system board has a finance committee, and that committee is incredibly diligent in advising management in terms of all aspects of our operations, but specifically when it comes to how we invest what's entrusted to us, be that gifts from people in our community or be that the earnings that we have. That finance committee has engaged with a nationally recognized investment advisory firm, an outsourced chief investment officer that advise and have strong expertise in how the money entrusted to us is invested. And again, we've been here in this community for 120 years. I'd like to say our roots are here, and so is our future. As a community-based not-for-profit, Mount Nittany Health has always relied on the generosity of our donors. With your ongoing support, we've been able to continue to grow and to provide nationally recognized services close to home, which is what the people that live this community consistently say to us, that they want to get their care from quality providers close to home. The generosity of people in our community has made it possible for us to participate in many expansion projects over the years. In fact, as you walk around here at Mount Nittany Health, you see the names of donors all around, donors that have allowed us to continue to advance and grow healthcare in this community. There are lots of examples, but I'll provide a few of them, such as the Drivabus Auditorium and that expansion which happened in the early 2000s. Also our emergency department in 2012, which is so badly needed at that time to allow us to serve the growing community and for life-threatening emergencies that happen to people who live here every single day. The Shaner Cancer Pavilion in 2012 was a beginning of bringing state-of-the-art cancer services so that cancer patients, once again, could get care close to home rather than having to travel so far out of the market for the care that they needed. The SIG Neuroscience Center, another great example in that same time period that allowed us to expand neuroscience programming for neuroscience diseases across our community. Most recently in 2019, the expansion of our cardiovascular pavilion. Our cardiovascular pavilion allows us to respond to cardiac emergencies and to be one of the best places in the country in terms of our response time and our ability to take care of people that have these very significant life events, such as a cardiac emergency. Most recently, we reopened the Paterno Family Women and Children's Services Unit that was originally named and recently renovated to better serve the moms and babies in our communities, and numerous other examples of funds that have been created that support ongoing programming that contributes to our mission of helping to keep people healthier and also helping to keep our community stronger. So as we look forward to the future, we continue to know that we're going to be dependent on partnerships with people that live in our community to hold on to that margin of excellence and continue to expand and reach even higher. We look for continued growth, and as we've come out of this very difficult time, all of us in our community, as we've come through the pandemic, our board went through a process of refreshing our whole strategic plan and looking at what's going to be required over the next number of years to serve the community. We're beginning to put together a plan that we call Mount Nittany 2030. And this is really going to involve extensive involvement in our health system, up to $750 million that we will be reinvesting to bring more advanced healthcare to our region. It'll include a new and improved laboratory with all new equipment, the refreshment of our diagnostic pavilion with new equipment there as well, a new outpatient pavilion that'll be in Toftree West, and the ongoing modernization of the hospital. All of these things allow us to continue to be the region's premier healthcare provider, and again, are made possible through the generous contributions and participation of people who live here in investing in the care that they want to get here. We simply could not do this without you, and we just look forward to and are so appreciative to the continued support that we have as we steward the resources that have been entrusted to us by you as we work to fulfill our mission. And again, that's healthier people and stronger communities. So thank you again today for joining us. Thanks for considering Mount Nittany Health when you think about how you can be part of making our community healthier and our community stronger.